Okay, so welcome to the second webinar in our series for Knowledge for Public Health. I'm going to pass over to all the people that will be speaking in this webinar today, just to do some very quick introductions. So my name is Liz Such. I'm leading the Knowledge for Public Health programme with colleagues Andrew Tattersall, who you've just met, Fiona Marshall, who's there on the screen, Joe Langley, who can't be here today, and Naeema Ahmed, who's on the call. Naeema, would you like to introduce yourself?
Thanks, Liz, and hello everyone. As Liz said, my name is Naeema Ahmed, and I'm the Senior Network Manager at the UK BME Anti-Slavery Network, which is a project of AFRUCA Safeguarding Children. So BASNet is committed to promoting race, equality, diversity and inclusion across the UK modern slavery sector. But as part of the No PH project, I lead the Public and Community Engagement Group, which is also known as PACE, and we are so glad to be sharing more about PACE today with all of you.
Great, thank you, Naeema. And Nusrat, would you like to introduce yourself as well today?
Yeah, thanks for giving me the opportunity to be part of this webinar. I'm Nusrat Echampong. I'm a district nurse in Cornerstone in Manchester, and I'm the founder of Proud Moms. So Proud Moms is a small network group for African women, which we get together to share ideas and then promote ourselves. Yeah. Thank you.
So as we mentioned earlier, this whole webinar is about community working to bring together evidence and research. And as I said, I lead the Public and Community Engagement Group, which is an arm of the No PH project. And I believe when Liz joins, she'll be able to share more about the No PH project. Andrew has also shared a link about it in the chat session, so I'll just go straight to what the PACE does. So as a community, the Public and Community Engagement Group, what we do is we kind of critique, review, and then comment on available research evidence to be able to gauge how evidence is presented to the very individuals who have been able to commission us to do the various projects that we've been doing. So far, we've been able to work on the homelessness project, and then a project with the Kent City Council. One thing that I need to mention is that PACE brings together individuals from a wide range of backgrounds who play important roles within their community. And as you heard from Nusrat is from the Manchester area, and her work as a nurse and a founder of a charity, she brings so many different perspectives to the very projects that we've been working on. What makes this group particularly unique is our intentional focus and inclusivity. So for the very first time, we've actively prioritized the voice of individuals from ethnic minority backgrounds, while also ensuring representation across the 9 protected characteristics under the Equality Act. So we've kind of done a reverse and flip the table approach, with the aim that this whole approach will be able to allow us to create a truly inclusive platform for shaping research and evidence gathering. So PACE members, at this point, PACE members are fairly compensated for their time and expertise, and their remuneration follows the NIHR's recommendation model for engaging public and community groups. So basically this is PACE. In being able to meet the 9 protected characteristics, so far we have about 8 members. We have a young person, we have male, female, individuals who are leaders of their own small charities. We also have individuals, an individual who is also a disabled person as well. The aim is that they'll be able to share these unique perspectives within their communities based on the kind of work that they what they've been able to see, or based on their lived experience broadly. I need to mention, and I hope that when Liz comes on board, she will also be able to mention that the No PH project is bringing together available evidence emanating from research. So it's not a matter of research, we are doing a whole new or virgin research. No, we are only probing available evidence within the NIHR work. And based on that, the work that PACE does is we are only critiquing or reviewing these evidence that already exists or emanates from existing research to be able to inform local authorities based on what they want to do or their approach based on specific subject matter. Andy, I just need to check with you if Liz has been able to come on. Otherwise, I'll be sharing all my nuggets before the whole webinar comes to an end.
Hi, Naeema. Yeah, I'm back. And
awesome.
Yeah.
So what I've done is I've just talked about what PACE is. So maybe just going back to talk about what the whole No PH project is about.
Yeah, thank you so much, Naeema. I think I caught most of what you said there. And sorry, everyone, for cutting out all the best laid plans and all that. I'll try and share my screen again and just everybody have their fingers crossed that it works this time. Okay. Great, I think you can see that now, is that right? Okay, so thanks Naeema for that introduction to the PACE. I'll take a step back now and just do a little bit of an introduction to Knowledge for Public Health, which is a collaboration between AFRUCA, 3 universities and the City of Doncaster Council, and funded by the NIHR Public Health Research funding stream for 3 years. We're actually halfway through. I can't believe how quickly it's gone. And with regard to public and community engagement, I feel we've come quite a long way from our starting point. So this was our plan for the session today. So Naeema's already spoken about the PACE group, which we'll talk about in Q&A. So we thought once I've done this quick outline, we would work in the format of a Q&A, so that here we're trying to treat this forum as an opportunity for like shared learning and to deliberate across some of the issues that have emerged in this unique programme, which is about involving communities and engaging communities in knowledge mobilisation. So like Naeema said, not a traditional research project with what people might know as public patient involvement and engagement, but with a knowledge mobilisation where we're taking the available evidence and trying to inform decision making, largely at the local authority level. So local government are very much partners in our work, but also with communities and people who might be the beneficiaries or intended beneficiaries of public health interventions. So I'll do a quick introduction, then we'll do some Q&A and have an open floor for queries and questions, again in this spirit of open and deliberative dialogue. It'd be great to hear other people's experience of doing this kind of work. So you've met the team. The only person not here is Joe, and we've already done our introductions, so that's completely fine. So as I said, we're funded by NIHR and we're the UK's first public health knowledge mobilisation team. Our intention is to bring evidence as close as possible to decision-making processes, but we recognise that evidence is just one form of knowledge. So we seek to mobilise evidence with other forms of knowledge, including public community perspectives. We intentionally take a creative focus. So Joe, as a design engineer by background, and has been great in supporting the input of user-centred design into the kinds of work that we do. We are creative in our thinking as well as in a lot of our outputs, which if you go to the links shared by Andy, you'll be able to see some of our creative outputs. But we're very much involved in creative thinking processes in the knowledge mobilisation work that we do. We see what we do through a health inequalities lens, so we try to apply that into all the topic areas that we work on, and we essentially adopt co-approaches. So co-production is the most commonly used term, and I think in terms of public and community engagement and involvement, we can't claim co-production, but we're working towards it, and we work in that spirit of developing the work in a co-productive way. We also involve co-design, co-creation, co-development in the way that we work. So we're intentionally using co-approaches. Overall, there are two main arms to the programme, a deep co-production arm, which is working with local government and partners over extended periods of time. And then we have these rapid response projects, which are, as they suggest, quick and enable decision-making informed by the evidence. And I think this is one of the challenges for meaningful community involvement engagement. These are the examples of projects so far. So in rapid response terms, we've worked on workforce mental health and workplace related stress with Lincolnshire County Council. We've also worked on mental health among children and young people with Kent County Council. And we're working currently with Hertfordshire County Council on on the evidence around community champions and networks in promoting public health, and in this case particularly improving air quality. So that's a live project, and we're still working on that with workshops planned this month. In deep co-production terms, they spent a long time working with Knowsley and Leicestershire on housing, spatial planning and health impact assessments. And here there's been the production of lots of different kind of knowledge outputs that aren't traditional, so things that you wouldn't see maybe as a peer-reviewed journal or something. It's a whole range of different outputs. Again, those are all accessible. If you want to go to the website, all our outputs and resources are there, although some of them are still in active use and not quite yet available. Okay. I'll stop sharing there because that's the role of the PACE that Naeema has already outlined. I think there's just the one thing that's worth saying that and reinforcing as we go into our discussion is this, while PACE are involved in topic prioritisation, feeding back to us on what we're doing, how we could do things better, inputting into our projects, and I can provide an example of that later in more detail if that's what people would like, and also commenting on our resources. I think we can probably say that this mode of involvement, of engagement of the PACE is very much on the community involvement model at the moment, and we want to move more towards these co-approaches. So having outlined no PH and Naeema and Nusrat having outlined the role of the PACE, anything further you wanted to say, Naeema, about the role of the PACE and how things are working? Or should we just go directly into Q&A?
I think we can go into the Q&A, but just as you said, I just want to stress the fact that we've been very, very intentional in our approach of recruiting individuals for the PACE group and who makes it to the PACE group. And I think this makes it quite different from traditional PPIs, PPE, whatever the semantics is, or the traditional PPI. We've been very, very intentional to give voice to ethnic minority individuals to be able to shape how we present these evidences to local authorities. So yeah, this is what I wanted to emphasize.
Absolutely. Yeah, thanks, Naeema. Okay, so maybe if I just take the privilege of asking the first few questions, and then we can do some toing and froing and then open it to the floor. So Naeema, can you just give me a quick outline of how the PACE works in its current form?
Yeah, so just as I've previously mentioned, the PACE mainly kind of shape the available evidence for the No PH team to be able to present it in a more, for lack of a better word, realistic manner based on the lived experiences available on the ground. So again, there is so much evidence available. So in going through and matching it with their lived experience, they are able to kind of pinpoint where the gaps are, what really needs to be done to be able to meet the needs of communities, and then better present it in such a way that local authorities will be able to look at it from a more realistic perspective. Another way that I need to also mention is that the PACE mainly operates in two ways. So we do have the main PACE group. So that is the more consistent group made up of 8 individuals who meet individually to be able to either comment on the rapid response projects or the co-production project. But we also do have what we term as the pocket space, and these are much smaller groups, but then they are convened in response to specific issues within particular local authorities or thematic areas. And one example is the work that we did with Kent, and I know that Liz will be able to share the outcomes and examples of what came out of that project with all of you at the end of the project. The reason why we chose this approach is that we know that when certain local authorities approach us, for example, again, using Kent because we've been able to work with them, is that there are certain local jurisdictions that are very pertinent to the very people who are there. So it will be easier to find someone who is within Kent to talk about mental health, how they're experiencing it, the services they are receiving, than someone who lives all the way in Manchester, like myself, or Newsrat, or someone who lives, let's say, Sheffield, to be commenting on mental health issues within Kent. So in using the pocket space approach, we are then able to find individuals within Kent who have lived experience within Kent to be able to comment on such issues. That does not negate the fact that we still have the overall pace who are still able to comment on the wider issues of what mental health is, and then be able to draw down to the lived experiences that are very evident within these thematic areas or local jurisdictions. I also need to mention that, so as much as we have the main pace and then the pocket space, having different individuals, and I think in my introduction I talked about our intentionality to be able to meet the 9 protected characteristics. Having such individuals represented on the pace gives us that broader perspectives so that we are not losing any voice. So again, I'll use the project on the mental health, for example. If we have a younger person, the perspective that they will share as compared to an adult, male, female, gives us a more varied approach, and the very issues that we are teasing out and the very evidences that do come out. And so far, it has been good so far, but it's still a learning curve for us. Just as Liz has said, it's still a learning curve for us, and we hope to be able to learn more and then share more across board.
Yeah, that's great, Naeema. So we've got these 2 entities, if you like. We've got the overall public and community engagement group, which is the overarching umbrella group that advises on all of the aspects of the programme. And then there's these mini pocket paces that we trialled with the Kent project, where we worked with 5 people who lived in the Kent area who felt they had something to contribute to the issue that was being explored by the council, which was children, young people's mental health. And that actually was a really, really helpful process. I can describe later on how that worked. Nusrat, I was interested in hearing how, as a member of the PACE, as the main PACE group, how the PACE has been working for you since we started a year and a bit ago.
Yeah, thanks, Liz. Yeah, I got to know about PACE through Naeema, and I think she thought because I've got good networking with the community, so, and being a district nurse, so that's why she approached me. But one thing that I've learned about this PACE group thing, being a member of it, is that it involves the minority, people from minority background. So it's like we've got a voice to come out with something. You know, sometimes you see there are so many research evidence or papers that the findings, we find it difficult to even understand all those things. And the outcome, sometimes they come to the community to just collect the data. We don't even know what happened with the information that we've given out. The outcome, the feedback, we don't get anything. But this is the case that you feel like you are part of it, whatever is going to happen. So it's just something that, to tell you, I had it's a privilege to be a member. So it's like being the community. People should just get involved if you have the chance, to join. Yeah.
Sure. And if you've had, I know that you've had some experiences working on research projects before. What were the the good things that we can learn from those experiences in research projects that we can bring to this knowledge mobilisation programme. So, some of the good things that other programmes, other projects you've been involved in and contributed to, what should we really take from those experiences?
Yeah, I had the opportunity to have one research with Manchester University, which was, I think, funded by NIHR. So it's all about, it was we came out to write a book about Manchester memories, the COVID-19 era. So something about the COVID-19, how people's experiences. So with that one, when we came together, we thought it's just like the normal research procedure that we come together, gather the information, and that's the end. No, this was different. It was our research. So you feel the ownership. It's different from, I've done so many research with other universities, but this one, I felt I own that thing, that ownership, that kind of, it belongs to me. So if I'm sharing it, I keep the book with me all the time. So that kind of community involvement, it gave me that chance to see that, yeah. And if what I learned about the community involvement is when we find out about the feedback, the outcome, because sometimes you go to libraries, how many of us read research papers? Sometimes the term that they use, their terminology and other stuff, we don't even understand. You sit there and realize that, is that what I said? Does this thing came from me? It's our own data that has been combined. But this is the case that we sit down we've got different kind of people in the community. You don't need to have that higher qualification before you can get involved. We had people from high school, disabled people, so many people from the community, from different backgrounds that we came together. True, it's like learning. It's not, and the one I love about it was not true formal learning. It's like coming together in the form of play, and we learned best through that way. Yeah. So that's what I took from that experience that I had with that project, and it's with me forever.
Yeah, thank you. That's actually really helpful. I already drawn some extra points from that about the importance of play, creativity, but also the kind of physical thing. You have the book that is a physical thing that you can have and share. So I think that's maybe something we can take forward further in what we do in NoPH, where a lot of what we produce is digital. So we maybe need to think a bit more about those sorts of things. Thank you so much. And Naeema, we describe you as our expert convener and much more besides. You bring a lot of skills and connections and networks that we simply wouldn't have access to as people based in universities, despite the fact that we've got a reasonably long-term and close relationship. What would you advise, what would you say about the sorts of skills and things people might want to take into consideration when involving community organisations, building up public and community engagement for knowledge mobilisation, thinking about knowledge mobilisation particularly, but research, of course, is linked to that. So what are the kind of skills and expertise you bring that could really add value to these sorts of programmes?
Thank you, Liz, and thanks for your kind words. So I think prior to preparing for just reflecting on my role within the knowledge mobilisation, I thought for any public and community engagement group, if you're looking for a convener, you're looking for a connector, someone who has some sort of connection within the community. And beyond being a connector, you're also looking at someone who's also able to see the bigger picture. It's not just about academics and certificates and all that, but then there are some individuals who are able to take 2 steps back and then take the whole information and then look at the bigger picture of it. I'll be very, very honest. I think at the very, very early stage of this project, whilst we were having all these conversations, there were a lot of the words that you were using that were getting over my head. I needed to take a minute to be able to process all that. And I think once I was able to process and understand the very core of the project, I was then able to step back and then make some suggestions, share some ideas for us to know how best we can proceed with this and the very individuals that we need to be able to draw in to make the project a success. And so yes, you need someone who is a connector, someone who is able to see the bigger picture, and then someone who is also able to listen. It's not just someone who can talk, because at the same time, it's just, you are bringing so many different individuals together with varied lived experiences, and you need to be able to probe the lived experiences that they are sharing. So you are not just hearing, but you are listening to be able to get the actual nuggets out of it for the betterment of the project. I've had the opportunity, for all those that I've been able to speak to or be able to convince or recruit, let me, for lack of a better word, use the word recruit, as part of the No PH project, I had to listen to their stories. I needed to know their backgrounds and assess whether their backgrounds would be a better fit for the project in that kind of manner. So you need a listener to be able to better understand all these individuals and then tease out the very lived experiences that they are sharing. One other thing I can also share is people skills. I really don't tend myself as having a people skill, but I think I'm still learning. But it's being humane enough to be open to the information that you are receiving, and also be open to learn on the job, because again, this is knowledge mobilization. It means that it's evidence being gathered in transit, moving in transit. So you should be open to learn the very information that we are receiving. Some will shock you, some will give you an aha moment, some will be just this is not the kind of information I'm looking at, but you just need to be humane enough to be able to grasp all of it and then make sense out of it for the betterment of the project. So I think these skills will be very helpful. But Liz, I also need to share that if you read one thing for anyone leading a page group or for any project considering having a page group, you need to be able to invest in the community that you want to get into. We all don't have the answers. And I'm particularly pleased and honored that you thought it's great to partner with AFRUCA Safeguarding Children based on the expertise that AFRUCA has for over 25 years. You know that they have the knowledge, they have the skills, they have the connection within the community. We've seen some organizations who will try to do it by themselves. You know, there are community organizations who do have the skills. There are community organizations who will be able to go way further than yourself. So again, we need to find ways of investing in the communities that we want to get into. And it shouldn't always be about a formal approach. We need to be looking at a more informal approach as well. I've met so many amazing individuals that if you were ever to put it, whether on an NIHR platform, Sheffield platform, or any of these institutions platform to recruit, you wouldn't be able to get such individuals because that is not where they'll be looking for jobs. That is not where they'll be going, right? So we need to find more informal ways to be reaching out to the best within the community, to be able to connect, to listen, to look at the bigger picture, and then be able to convene all these individuals for the betterment of any project that you're trying to bring together. I hope this helps.
Yeah, thanks, Naeema. That's fantastic. And I love the idea of us all being in transit. The knowledge mobilisation is transitional, forever in movement, and also the idea of having to adapt as we go. It's not, there's no sort of beginning and end to the process of knowledge mobilisation. Just wanted to share with everybody as well, while a question there from Jude about how we've to share an example. If I just give an example from the Kent project. So here, Kent, we're looking to to recommission a children and young people's mental health service for children and young people with mild to moderate mental health need. This was the process that we took, and it might also help answer the question raised by Andrew in the question at the top of the chat about moving more towards co-approaches, because I feel like this is an example where we were moving more towards co-development or co-production in knowledge mobilisation and not just involvement. So Naeema, feel free to comment on this too, but we started off with PACE input. So this was the broader main group, the public and community engagement group, input into the topic in question, which was children and young people's mental health. They helped the researchers focus on where, on what was of interest and what should be focused on, as we were also at the same time looking at the evidence base and communicating that with the PACE, and also assessing the need within the local authority that we're working with. So here you can start to see some delicate and difficult balances between those different interest groups, so PACE, local authority, and the evidence base as it stands, which may be more or less adequate. So we've got the sort of triangulation there of the three factors, which in this project, which was 6 months long, was actually really challenging. In response to the need for some sort of local and specific knowledge, Naeema set up our pocket PACE, which was 5 people living in Kent, and the people from different backgrounds and parts of Kent. What that helped us do was understand what living in Kent was like, what the issues were around children and people's mental health. People were living in different areas, had different local knowledge and diverse experiences, different stages in the life cycle and so on. So the pocket PACE was set up, and what we did was then bring the an online discussion with the evidence that we'd selected through this sort of process that we use in NoPH to take to local government in collaboration with them. We were going to conduct what we called an evidence jam, which was a half day of active interrogation and exploration of the evidence that would be relevant to the question that they were addressing on their commissioning of their service. So that we could get some insight on the areas that might not be in the evidence base, but were of interest and importance in that local context. So we had this online discussion, and these were the things that were highlighted by the pocket PACE on what we should be using to inform the evidence jam. And we did this with research teams as well, so research teams that have conducted studies. And the things that came out were really helpful for the research teams that were part of the evidence jam and for the discussion with decision makers, which included the council and the ICB, so the local NHS infrastructure. So the focus should also, so we were advised to focus on things like diversity, cultural adaptation to interventions, diversity of activities, and bringing children and young people together and supporting parents, also supporting informal peer-to-peer work and making sure that interventions built confidence, self-esteem and trust. And we could see that whilst a lot of these kind of findings were evident in the evidence base, there were some things like cultural adaptation that weren't there necessarily because the studies hadn't been conducted, but it was an important consideration when we were then engaging in the evidence jam in our discussions that was informing the decision that was to be made by Kent. The other issues there are around implementation, so factors that you might like to see in delivery and some of the process and outcomes monitoring. So that's how we conducted the public and community engagement in this pocket PACE format, and then afterwards, after the jam, we fed back to the PACE group on the value and the impact of their input. But I suppose what we didn't do, and I'd be really interested to get Naeema's opinion and Nusrat's opinion on this, would be how we could have brought those 5 people together with the decision makers in the local authority, if that's possible, feasible, desirable, what the challenges and barriers might be, because it's a nice sort of addition to knowledge mobilisation work, and there are many advantages, but this was quite a short period of time we had, and did we do the best that we could in this situation, or could we do a bit more in another one? What do you think, Naeema?
I think we could have done more. And that is one of the challenge, I think, prior to this, it's a conversation that we had. It's one of the challenge or the things that we've seen so far, where the pace is more like an intermediary of showing or critiquing or reviewing how the evidence should be presented. We do not have any contact with the local authority themselves. It's based on what the no PH team presents to them for them to critique, right? So we do not have access to the source of the main information or exactly be able to read in between what exactly the local authority wants is what we present to them and the very feedback that they give to us. And I think moving forward, it will be very, very helpful if we are able to bring the commissioner, the source of the information, the one who will be able to implement it with the pace, so that we are both probing what the evidence is saying against lived experience or as against the realities on the ground. And I think that will be a game changer if you are ever able to do that. But so far, as I said, it's still in transit. It's still a learning curve. This is what we are gathering so far. And I know that by the end of the project, we would have been able to come up with a more nuanced ways to be able to do this better as compared to traditional PPIs or traditional public and community engagement groups.
Mm-hmm. Yeah, that's great, Naeema. Nusrat, do you have any other thoughts on how we could move this on in the next 18 months as we move towards the second half of No PH?
Yeah, I think Naeema has said most of it, but what I'll add to it is that, as she said earlier on, if the recruitment process can be more informal so that you can get more evidence, gather more data from the community, the people involved, because you can learn more, you get more information if you leave it in not formal way of recruiting people to join the pace. It helps. That's one thing I've observed, that it helps to gather more information if you decided to make it informal, because some people in the community, some of them got experience but how to even get involved might think I might not be qualified or I'm not to that level. But if we make it informal way, it will be able to get more information from people than,
Yeah, thanks, Nusrat. I like the idea, Naeema, you mentioned connectors. You're a connector, and I suppose knowledge mobilization is often seen as a connecting discipline. So we're connecting with you, Naeema. You're connecting to your networks. To Nusrat, you're connecting to your networks. I think that's a really nice, chain of connection that we can perhaps make better use of as we move forward.
Yeah. Liz, can I also add, based on what Nusrat said, all this borders on trust, right? And I'm just saying this to highlight what Nusrat was saying in relation to informal recruitment and informal connection with people within the community. So whatever the information is or whatever lived experiences individuals are sharing borders on trust. So they're looking for someone that they can easily trust and someone that they hope that I'm sharing part of my life with you. At the end of the day, what is it going to mean? What exactly is it going to change? So again, we need to be able to look at it in such a way that whatever we are doing is revolving around that kind of trust that people are giving to us. And then we are honoring that back to them in whatever way, shape, or form. And going the formal way will not necessarily be able to kind of fill that kind of trust gap at any point in time. So however we want to look at it, we need to be very, very open-minded and then know that people are sharing their trust with us. I maintain that traditional researchers have really messed it up for new researchers in a way that they've taken so much information from the community without going back, and people are very, very skeptical about opening up or feeding back. So new researchers are more struggling, going back to communities and getting information. And this is the best approach, finding the very people that they will trust to be able to lead that conversation to make it easier for them. So yeah.
Absolutely. Yeah, thanks so much, Naeema and Nusrat. Some really helpful thoughts and comments. I think it'd be good to open to the floor and maybe see what some of the questions are in the chat. Andy, have we got some there?
Yeah, there's a couple of questions that have come in the last few minutes.
From Lisa, practical steps about making things more informal and what kinds of formal practice that put people off contributing. So yeah, I mean, just from my perspective, Lisa, the kind of informal only comes really through developing the initial relationships. So I feel like over the several years that we've been working with AFRUCA in various capacities, like the relationships between Naeema and other members of AFRUCA have developed so that informality is part of the way that we operate. And I guess, Naeema, there's something similar going on about informal approaches from your side too. So I don't know, it'd be good to hear what your thoughts are on how to make things more informal and maybe what NIHR or other funders can do to facilitate that informality so that more people are involved, more people are interested.
This is what I will say when we talk about the informal approach, and I think I need a caveat here. Saying that you should take the informal approach does not mean that you shouldn't do the right thing. Or we are not saying that, for example, if you've met someone who is a good connector and is an immigrant, doesn't have the right documentation, you're still going to get a person to be able to be part. It's a matter of navigating that based on the subject matter that you're leading on and so doing the right thing. What we are saying is that there are formal channels that organizations go to when they say they are recruiting for individuals. There are certain roles that will not yield to such formal channels. That is one. So you are either looking at areas where you'll be able to meet the right people, have the right conversations, and then meet the right people who will be able to fill such roles or be able to support your project to get to the right people. That is one. The second one, and I think earlier on I talked about investing in the communities that you are in. If you are fixated on formally recruiting someone who has a master's in public relations, to be able to fill such a role, you'll be missing out on someone who just has an HND, a good connector. You've seen all the evidence within a particular community, and yet you wouldn't be able to take such a person on because you have a tick box approach of seriously you're looking for someone who has a master's in public relations and that is what you're looking for. So again, that is a typical example. Another thing is that if your focus, if your project, again, I'm going beyond knowledge mobilization to actual research. If you're doing a research that is looking at young girls, young women, boys, exclusively LGBTQ community, and you know for sure that there is a community organization who has done this work or who has access to this community, you are better off approaching them to be able to tap into their resources and connection rather than, again, using formal channels to recruit someone, again, who has a master's in this, looking at that. I'm not saying this is all wrong. That there may be thousand and one examples of people going the formal approach and having real people who are able to meet their targets and do awesome work. But we are still putting it out there that there are still amazing individuals out there who are able to do this connection effortlessly and are able to build trust effortlessly. And you are better putting your dime on them than your traditional approach. So these are some of the things that I will be able to share. It's not all wrong if your organization is still stuck in the traditional approach of recruiting individuals. That is okay. But this is an alternative of what could work, what we've seen working, and the amazing individuals from a personal perspective I have come across. I wouldn't have been able to meet Nusrat if we had shared this on our website looking for someone to join PACE. I went beyond that. I was contacting individuals that I have networked with. I've seen their work. I know their perspectives and the lived experience that they are able to share to say, this is the kind of project that we are doing and I think you'll be a good fit or it will benefit you. Of course, I needed to convince Nusra. She's a mom. She has 1,001 things to do, but I still had to convince her to be able to give off some of her time to be part of this, right? So yeah, I hope this helps, but I think it's just a matter of reflecting and looking at all these approaches.
Sorry, Naeema, with formal recruitment, when you talk about NHS got a formal way of recruiting staff. And sometimes if you are not a member, it's hard to see some of the job that it's been advertised. I'll take myself, for example. I'm a community person and I met my manager through community work. I was not working for NHS, but through informal way, I had a healthy work. I never knew that she was even a manager. And I met Angela. We had a talk and then she realized that, oh, Nusra, I can be a community nurse, a district nurse. And I was like, I don't have that. I've never worked. And when you look at their formal recruitment process, they want somebody with experience in the community, which I don't have. So I will not even have the chance to even apply. But for that moment, she asked me to go online to go and apply. And I had a job. I've been there for almost 2 years now. So sometimes they've got their formal recruitment way, but it can start from somewhere. And then, being in the community is just something that I can't get out of it.
And I think there's so much to learn from the experiences of both of you were working in community settings about how us as researchers can learn on issues, things like recruitment or bringing people in to shape research and to inform research and to do the same with knowledge mobilisation that we just haven't learned yet. So we could probably do some really useful, moving forwards in OPH, do some really useful gathering and sort of brainstorming, putting all these things, documenting them to support other people trying to do this work. So I know that in the room, for example, we've got some local authority research practitioners who will be connected to community organisations, and maybe that's a mechanism for trying to sort of bring this sort of really rich knowledge and all of these important networks together to make sure that evidence alongside other forms of knowledge makes its way more into the decision-making process for local government. So I think there is something really rich and important in there about the sort of ways in which we've traditionally done research and knowledge mobilisation and how we disrupt that so that it's more owned. And again, it goes back to the co-approach. It's more owned by community organisations and people that are working at a very local level, which is ultimately what things like HDRCs, the health determinants research collaborations and OPH and local authority research practitioners, that's what they want to do, what we want to do. So I think that's really important. Just looking in the chat, there was a question from Jabu about the evidence that we've been able to review. What we do when we've got a topic suggestion, which comes from a range of sources, including the PACE. So when we've got a topic suggestion for a project, we go to the evidence base and we look at all of the NIHR evidence using search and SIFT techniques. And then for the deep co-production topics like the housing topic, for example, Fiona's done a really comprehensive review of lots of different evidence sources, not comprehensive in the sense of a systematic review, but gathering lots of information together. We've found that local authorities do generally like material which is very focused on the local government setting and is relatively new and so context relevant. So local government undertakes quite a lot of change on a regular basis. So something that's context specific and relatively new is popular. Emerging findings as well from current research, especially things like the public health evaluations. So the first teams is very popular. So we gather the evidence and we go back to the local decision makers and ask them what most meets their current situation. So is it something that they want to find out more about to help consolidate a particular project? So with Kent, for example, and they'd already conducted some literature searching, but it was quite narrow, so we helped to expand on that and helped Kent find some more relevant material that met their needs. And then they were able to discuss it with the people that had conducted the studies, which I think was of really good value. We know we do from some of the feedback that we've got. And I suppose from a PACE perspective, it's about then enriching it further with community and public involvement. And Kent, in the instance of their recommission service, they also had conducted some public consultations, but not in the kind of same way that we would do PACE work, which is, more using sort of qualitative style research methods. So that's the kind of work that we do. Naeema, and Nusrat, just to have the sort of final few comments as we reach the hour, how would you like to see this go in the next 18 months?
Before final words, I think there is something in the chat that I would like to comment on, if that's okay with you, and that's coming from Connor regarding compensation. For the longest time, we have been campaigning and raising issues around compensating individuals that we do engage from the community in our projects. Whether you are engaging survivors or community organizations or individuals with lived experience, it is not okay to assume that they should give you their time for free. It is not okay to assume that they can share their lived experience with you for free. If you need to find the money, you need to engage them at the very beginning of your designing stage so that you find the money to engage them. It is so disrespectful, and I've intentionally slowed down so that these words will come out and then we will all be able to understand it clearly. It is extremely disrespectful to go into a community for someone to leave their day job, whatever they are doing, come sit with you 30 minutes, an hour, share their life with you, and you think it's okay, and not give them anything to compensate them.
Okay.
If you want to find the money, you will find the money. That is why you need to engage community, public and community at the very designing of your project, so that when you're going to a funder, you've thought about them and then you've included them in your funding request. This is extremely important. In 2025 going forward, it is so not okay to assume that you can engage people for them to give you their time for free. And that is why in my introduction, I had to be open and say that we do compensate our PACE members for their time and expertise. The money may not be enough. We hope to do better, but at least we are compensating them for their time and expertise that they give on this project. So please, I know for the very individuals who are on this project, some are in positions who will be able to do better. Please take this back to your team. You do not engage the public and community at the end of your project or in the middle of your project when you've already got the money and now you're scrambling around to think, how do I pay them? No, it doesn't work like that. Engage them at the very point that you conceive the idea. And I'll use this opportunity to say a huge thank you to Liz and her team. When she decided to do this project with her team, she engaged AFRUCA at the very beginning to have an initial conversation. How will this go? And then even think about how the compensation will go. We know academic institutions have their own bureaucratic approach in relation to payment. And again, we've been campaigning around that and pushing for changes. But I hope in the next few years, hopefully something will come out of it. But I need to stress that it is not all right to take people's time for free. It is not
Absolutely,
on.
Naeema.
Let me put it that way. Thank you.
Thank you, Naeema, and I'm so sorry, Nusrat. We'll continue this offline. Thank you, everyone, for joining us. This recording will be made available online, and we just hope you'll join us for our next one.